Hello, everyone. Ron Vitale here, nutritionist for Siskiyou Vital Medicine, coming to you with Wednesday Night Live. But unfortunately, due to technical difficulties, we are not live. We are actually recording here. And as you can see, Dr. Duncan and Dr. Halsey are not with us tonight as they are on a trip in Arizona, getting some additional education, which is always a wonderful thing. But I am joined tonight with Dr. Casey Freider, who is a chiropractic physician who specializes in holistic skincare. I'm really excited to be with him tonight as his presence is coming into the office a little more now. He's going to be offering some of his services at the clinic, and we're going to talk a little bit about tonight about what he does offer. But the topic is skincare, and that seems to be a specialty of yours. And if you don't mind, could you tell us how you got into it a little bit?
That's right. Okay. Well, all physicians take at least some training in, basics of dermatology, or study of the skin.
Mm-hmm.
So I did that back when I was in medical school. And then during that time, I also met a great mentor who's Dr. Adiel Tel Oren. He's an Israeli physician.
Mm-hmm.
He's a medical doctor and a chiropractic physician. And he developed a treatment for removing skin lesions over 25 years ago that he's been using with patients. And so I met him while I was up in Portland during that time, was really impressed by just his holistic approach, but also just his encyclopedic understanding of all things physiological medicine. He really is a master in the field and really, really grounded guy, true humanitarian. And so connected with him and found out about this treatment that he has pioneered, and actually received the treatment myself to remove a few spots that were questionable, potentially precancerous on my shoulders here.
Mm-hmm.
So that's how I first met Dr. T. And then we're going to fast forward about 5 years later, out of school. I've been in practice for a couple of years. One of my uncles was re-diagnosed with melanoma, which is the most dangerous form of skin cancer.
Right.
Unfortunately, my uncle, about 6 months after that, maybe even less, he passed due to the melanoma. But when it came back, it really caught my attention, and it made me think of Dr. T as he goes by, and I thought, what, I should get in touch with him and find out. I want to be able to offer that. I want to be able to help to remove potentially dangerous skin lesions before they become a problem. And so sent Dr. T an email, and within 24 hours he had responded. We made plans to connect and start training. And so he went on to train me and certify me in the procedure. There's several physicians, mostly on the West Coast, but across the country, some in Europe, several in Israel, who he's trained worldwide. And he's really created a network of physicians that are offering this treatment.
Excellent. Yeah. I love how personal stories are the ones that drive us into our passion so many times. And,
Absolutely.
And it's nice to hear that. So the skin is the body's largest organ.
That's right.
I don't think a lot of people realize that the skin is actually an organ.
Yeah, I think most people, when they think organs, they think about what's inside,
right?
Compartmentalize all these little different things. But yeah, everything inside is actually encased by the skin, which is the largest organ in the body.
Wonderful boundary layer that we have.
Yeah,
that kind of is that boundary between the inner and outer world.
That's right.
And it's a really important protective. And we have internal skin too, like the digestive tract is like an internal skin. It's epithelial cells, just like we have epithelial cells on the outside. And from your perspective, what are some of the crucial roles that the skin plays?
Okay, well, first and foremost, the skin does provide this protective layer, against the outer world, the elements, and so on. The skin creates this mechanical barrier to prevent things from getting in, what's perceived as kind of the outer world coming in to the inner world. But it does so much more than that. It also plays such a huge role in how we interact with the world through the senses, essentially.
Yes.
So this is a key point, is that the skin and the nervous system are really one and the same. The epithelium, which is the outer layer of skin, and the nervous system all develop from the same type of tissue embryologically. So they have the same origins, and then they go on and at certain points differentiate. But that that close connection from the beginning really plays out, and it's really clinically relevant and important, as maybe we'll talk about in a little bit when we're talking about specific conditions or dysfunctions of the skin. But if you think about it, we have sensory nerves all through our skin. Anywhere that you're touched on the body, on your skin, you feel it because there's nerve endings there. And so it plays such an important role in how we interact, and we can look at pleasure, how the skin acts. So it's not just a purely protective organ in that sense.
It's actually a source of nourishment.
It's a source of nourishment.
I always like to call all of our senses food. It's nourishment for the human being. And I think of like the Romanian orphanage issue that happened. I can't remember the exact time, but children weren't receiving enough healthy touch in an orphanage, and they were having failure to thrive because of lack of healthy touch. So the skin, when we touch, it's a source of nourishment.
That's right. Body. It's a source of nourishment. It actually, chemical processes happen just by being touched. Nerves fire. Chemicals move. Things actually, measurable, results occur.
Yes.
Just as a result of that. So that's a really good point. You also mentioned the inner world. I often tell people that the skin and the GI tract are really one and the same. It's like a sock turned inside out.
Right.
Because the GI tract would be that other barrier from the outer world, that if anything is going to get really into our cells, it has to first go through either the skin on the outside or the GI tract on the inside.
Right. It's the outer world running through the inner world is really the GI tract, right? Open-ended, walled off, epithelial cells. So absolutely.
And then when you speak of nourishment, of course, then it's even more concrete when we look at, the nourishment which you specialize in nutrition. The way that we actually absorb molecules, we actually absorb substances from the outside world and then integrate it into our body.
So that being said, the skin is highly absorptive, isn't it? So pretty much you're going to absorb quite a bit of what you put on your skin.
Quite a bit of what you put in comes in. It goes both ways. The skin is one of our primary ways of detoxing. And so through sweat, when we sweat, that's one of the ways that we get rid of toxins. We release them out through the skin. Well, it doesn't just go one way coming out. We really do have to be aware that anything that we put on our skin has the potential to come inside our body.
All the more reason to be really careful about what we put on our skin.
That's right.
And there's a lot of toxic substances in skincare products. It turns out. So things like parabens, methyl and propylparabens, and a slew of other toxic compounds that are in our skincare products.
Yeah, this is an issue that's, I think, really big, and it's going to come out more and more. And the shame in it is that most of the time when we're putting on skincare products, whether it's sunscreen, lotions, we're doing it with a good intention. People are doing it because they're like, okay, this is something that's going to protect me. Well, unfortunately, that's not always the case. It's oftentimes creating a lot of toxic exposure.
Right, exactly. And it's my understanding that even when the sun hits, interacts with like the sunscreens or the chemical sunscreens, that there's a chemical reaction that takes place that makes it even a little more toxic. I don't know if that's the case or not.
Yeah, I'm not sure on the details of the specific which chemicals might react in some ways. I know, like oxybenzone, some of those chemicals that are, that can be absorbed directly, that has been measured, are really quite toxic on their own. But whether or not the sun can then actually, affect them in a way to make them even more so. But bringing up sunscreen, that's actually a really interesting issue because, people wear sunscreen to be protected from the sun's rays. And, there's no question, it's scientifically proven that getting excessive sun exposure, particularly when we burn, any kind of sun damage, that is linked with an increased chance of developing certain forms of skin cancer over time. And in fact, getting sunburnt is linked with an increased chance of getting all types of sunburn.
Oh, how about that?
But if we take a little step back, it actually gets a little bit more interesting because just getting sun exposure, total amount of sun exposure is linked with getting a couple types of skin cancer, the basal cell carcinoma and the squamous cell carcinoma. However, sun exposure on its own is, as long as we're not burning, is not linked with an increased incidence of melanoma. So I don't know if I said that very
interesting.
clearly.
Yes, you did.
But it's actually the opposite. Sun exposure has been shown to be protective against melanoma, which is the most dangerous form of skin cancer. And in fact, office workers, people who are always covered up and don't have regular sun exposure, have a higher incidence of developing melanoma.
How about that?
So there's some subtleties with that. Bringing it back to the sunscreen where I started, is that not all sunscreens are created equal. So some have these toxic chemicals in them. But then also, the point of the chemicals is to block the sun's radiation.
Right. The UVB rays specifically, right?
Well, actually, it's a little bit more nuanced. So we have the UVB rays and the UVA. We'll just keep it at that. There's other rays as well. They're just different wavelengths, different forms of energy that we receive from the sun. Now, the UVB is what triggers a sunburn.
Okay.
They specifically interact with the cells in a way that triggers the sunburn. Well, you can think of the sunburn as the body's actual warning system that we've had enough sun. So if we're covering up, just with sunscreen all the time, and we're not getting, that we're blocking those UVB rays, then perhaps we're turning off that signal that, hey, it's time to get out of the sun. And the reason is because we're always getting the UVA rays as well. The UVA rays penetrate more deeply.
That's right.
Yeah, and so some sunscreens only block UVB. Some sunscreens have been shown to block both UVA and UVB.
Do you have a particular, when you look at a sunscreen, what are you looking for in a sunscreen?
Well, I'm looking at it for a sunscreen that basically that it's non-toxic, so that it doesn't have any toxic chemicals, and most of the chemicals that you see are toxic. So basically what we're bringing it back to is zinc oxide.
Yes.
There's zinc oxide and titanium oxide are two that show that they're not absorbed through the skin very well. So that's a good thing, because we want them on the surface, not going underneath. However, there are some products that people have created nanoparticles. So they've created these zinc oxide and titanium and created really small particles, because people don't like the whiteness on, of sunscreen. They want the sunscreen to rub in so that they look better. Well, unfortunately, by creating those tiny particles, that increases the chance that we are actually going to absorb those chemicals into our skin. Now, while they haven't been shown to be dangerous on the surface of our skin, it's a different story if we absorb them inside into our body.
Right.
Titanium dioxide only blocks UVB. Zinc oxide seems to block UVB and UVA. So for all of my patients, I recommend a non-nano zinc oxide.
Non-nano zinc oxide sunscreen. That's what you're really looking for.
Yeah.
As we go into the winter months here.
Yeah, right. Going into the winter months, it's not as big of a concern. Now, I've read that in Europe, the testing is much more stringent. They seem to be a few steps ahead in actually putting the science into practice. All the sunscreens on the market have to be shown to block both UVA and UVB. And they are much more aware of the toxic chemicals, and a lot of these toxic chemicals have been outlawed. I can't say off the top of my head which ones. But, I want to make sure at this point that gets across that sometimes sunscreen might give you a false assurance that you go out into the sun as long as you may think, as long as I'm not getting burned, I'm good, I'm safe, I'm not getting any skin damage here. Well, as hopefully I've explained that's not always the case. Does that make sense?
Yeah, absolutely. Yeah. It's interesting that we need some healthy sun exposure for the health of the skin and to prevent any kind of deleterious effects from the sun, in a sense.
That's right.
Right?
And so it's really, we need healthy sun exposure, for vitamin D, to produce vitamin D, which plays a huge role in so many physiologic processes, really supports the immune system. But it's all about balance.
Yes.
You know, it's all about getting the right amount. So for people, you know, for fair-skinned people, you know, I usually recommend daily to get maybe 20 minutes of sun exposure. And it's great to get sun exposure all over your body, you know, legs, torso, places that perhaps you don't usually get just going from car into a building, you know, just on your arms.
Is there a particular time of the day where you find the best sun exposure?
It's going to be when the sun's the highest, you know, it's going to be midday, early afternoon in that time. Just getting limited amounts. And then over time, as we tan, then we can tolerate more because we're building up our body's own intrinsic capacity to tolerate the sun. Melanin.
Yes,
exactly.
Melanin is the hormone that causes the skin to tan, and so darker skinned people have higher levels of melanin. And as we tan, our melanin levels go up, and we can tolerate more sun. And also, if you are darker skin, it takes more sun to get the vitamin D that you need as well.
That's right.
Yeah, very important.
Yeah, and so, you know, we live in Oregon. I recommend to all my patients for at least 6 months of the year, say, you know, October through April, that everyone's taking vitamin D3 supplementally because we're just not getting the intensity of sun here that we need, I think, to synthesize enough vitamin D just within our bodies. But particularly if you're dark-skinned, it's even more important, you know, to take that supplemental.
Are there any with your patients and skin health? Are there any supplements or foods that come to mind for you that help with the health of the skin?
Absolutely, yeah. I really look, and I'm be curious to hear what you recommend, but I really look at the basics. You know, vitamin C. Vitamin C is so important for building healthy tissues. You know, connective tissues. So maybe we're looking really getting underneath the outer layer, the epidermis, into the dermis. You know, all of the connective tissue there. So vitamin C, already mentioned vitamin D. That's a pivotal. Vitamin A is a really important one. Vitamin E are a really important one. Now I could make this list of all these different vitamins, and you can say, okay, I'm going to run to the store and buy these vitamins. And for a couple, that might be a good case, but perhaps an even wiser way to go about it is to eat foods that already contain all of these different nutrients, because, you know, what we're finding more and more is that vitamins, micronutrients, they work together. You know, they work synergistically. And, you know, I don't know if we'll ever get to a time where through science we understand, you know, all the mysteries behind the way that our body interacts with the world through nutrition.
I so agree with that. One of the things I always say to people is that nowhere will you go out in nature and find the vitamin C tree, right? It doesn't exist. You're not going to pick vitamin C by itself. So all of our vitamins and minerals throughout human history we've gotten from our food. Humans are designed to receive their nutrition from food. Only in the last not even 100 years, it started in 1929 when Casimir Funk isolated B1. So you know, we're looking at a very short period of time where we've worked with isolated individual vitamins and minerals, and so they don't have the same bioavailability in our system that food does. Food has this, what I like to call, an innate intelligence, that when we eat food, there's all these factors and cofactors, and there's this matrix that the vitamins and minerals are in that facilitate the absorption and retention and assimilation and utilization, or what, for one word, that would be bioavailability of all those nutrients. So I think food is always the best first way to go, and then you can add in supplements as an insurance factor, perhaps.
Yeah, I would agree with that 100%.
Yeah.
I'm looking at specific foods. I really like to look at what's in season, you know, and particularly in the summer months. You know, what we find if we just look at fruits, you know, if you look at the fruits that are in season throughout the year, well, in the summer months, late summer, when the sun's most intense, when it's hottest out, then we have juicy fruits, you know, and so there's more water and there's more fluids, and so we obviously need that, you know. We need to be more hydrated, so we're looking at peaches, melons, you know, these kind of juicier fruits,
and watermelons, and then there's, I mean, tomatoes, which is a fruit.
There you go.
You know,
tomatoes are fruit as well. And then when we transition into fall, then we get into maybe pears, apples, Asian pears, stuff that, still packed full of nutrients, not quite as much, not quite as much liquid in per unit, but, just a different flavor, and I really, really trust in that eating seasonally, is that Mother Nature has this intelligence that really provides what we need.
Mm-hmm.
We look at how we evolved as humans moving around foraging, and we were eating only what was in season. We weren't preserving foods. We weren't shipping foods from the southern hemisphere to the northern hemisphere.
Right.
So
our food wasn't more traveled than we are.
That's right. Yeah, that's right.
That's like a litmus test. If your food is more traveled than you are, that might be an issue.
Yeah. So what about you? What are some of for skin health specifically, what are some foods that you might recommend?
So for me, with skin health and foods, I really like to look at foods that are like your dark leafy greens, things like kale and spinach and collard greens. These foods that are really rich in nutrients like lutein and zeaxanthin, your carotenoids. So things like carrots, all the foods that are antioxidant rich specifically. So. Kale is a big favorite of mine. I like to call that like North America's superfood. Really, it's so nutrient dense. So I'm really looking for foods that are really high in fat soluble vitamins as well as antioxidants like lutein, beta carotene, zeaxanthin, astaxanthin, because all of these will penetrate into they're antioxidants for the skin. So when the sun's rays are coming and interacting with the skin, there is free radical production there. And so what these antioxidants do is they quench these free radicals that are produced in the skin, and it helps protect the skin from any potential damage from the sun, and slows the aging process on the skin, which is really important. So those are some of like your dark leafy greens, your colorful fruits and vegetables. Those are the things that I really look for.
That's great. Yeah. So as important as it is to be eating the right things, it gets equally important in case by case, but sometimes even more important to avoiding certain things, because even if you're eating all the right things, you might be there might be a spoiler in there,
So always
there's always the spoiler. So
I'm
sorry to play the spoiler here, but big problem in our the modern Western diet, standard American diet sometimes, is that there's this big imbalance in fatty acids.
Yes, thank you for bringing that up, because that's a huge one. We put lotion on our skin to moisturize our skin, but when you take fatty acids internally, it actually helps with skin health from the inside out as well.
That's right. So in a nutshell, it's this imbalance between the omega-3s and the omega-6s.
Right.
And without going into the details, the omega-6 oils in excessive amounts tend to be pro-inflammatory. They promote inflammation. So if you have any kind of skin issues, whether you're prone to getting rashes, you have acne, this is something you want to avoid. Foods that contain a lot of these oils are the seed oils, the canola oil, sunflower oil, safflower oil, processed foods. If you go into your supermarket and you pick up a bag of something, a box of something, chips, crackers, any type of processed food, and there's so many, I almost guarantee you one of the first ingredients in it will be safflower and or sunflower oil, vegetable oil, canola oil. These seed oils, they're unstable at room temperatures, and so they go rancid almost immediately. So they're rancid before they even make it to the shelves.
Well, the processing that they go through even is just they're bleached, they're deodorized, they go through a horrendous process. By the time they're in the bottle and to you, it's you can't call it food anymore.
That's right.
Yeah.
And so studies of people living in a more natural environment, I think oftentimes have shown that these omega-3 fatty acid oftentimes exist maybe in a 1-to-1 ratio in the body. Well, oftentimes now we're looking at like a 20-to-1 ratio in favor of the omega-6s. So it's really out of balance. And so I think for a lot of people, it could be even the highest yield step they can make in terms of improving their skin health is just removing some of these really unhealthy foods. The next one on the list would be sugar.
Yes.
You know, sugar is a disruptor in so many different ways. I mean, you can maybe give us a few examples of just
Well,
specifically related to skin.
Yeah.
What it,
I like to call sugar the gateway drug.
yeah.
I mean, it's not alcohol or cannabis or things like that. Sugar is the actual gateway drug. We know that it's more addictive than cocaine significantly. It lights up the limbic system of the brain with much greater intensity than most hard drugs. So, it's refined, it's processed, it's a drug, and it's an anti-nutrient. It'll rob your body of vitamins and minerals and other nutrients that you need for optimal health and well-being. So you just really want to avoid the refined processed white sugar. So yeah, that we could go on and on. That's an entire show right there.
Yeah.
It's just sugar. We have about 5 minutes left, and so tell me, skin lesions. This is your specialty. Will you tell us about what they are, and how you work with that?
Yeah, absolutely.
Excellent.
So a lesion is just a general term. So a skin lesion is any abnormality on the skin. Ideally, skin is meant to be flat and smooth. So skin lesions are things like moles, skin tags, hemangiomas, birthmarks, seborrheic keratoses, solar keratoses, xanthomas, which are the little kind of fatty deposits often seen up here around the eyes. So, and it kind of goes on and on. So there's many different classes of skin lesions.
Mm-hmm.
And so the treatment that I offer, which I learned from Dr. Tellerin that he developed, is applying a specific compound. It's an acidic compound that it's so simple. We just apply it topically. It's very precise using a toothpick. And what it does is upon contact with the lesion, the solution, it constricts it. And in constricting the lesion, it's cutting off its nutrient supply. So it's isolating the lesion. It cuts it off from the rest of the skin. And then what will happen is that lesion then scabs up and it's able to just fall off.
Mm-hmm.
And so this is a way that we're able to really, really precisely treat any of these lesions. And it's amazing the array of different things that can be treated. It's also very safe to treat because it's so precise and because it constricts and isolates. It's not spreading.
Mm-hmm.
We can treat in very sensitive areas. So we can treat in mucous membranes.
Wow.
We can treat inside the mouth, the lips. We can treat on the inside of the eyelid, which is, we can treat on top of the eyelid. These are places where they're actually quite common for getting different types of lesions. Skin tags can often form. Sometimes, basal cell carcinoma, different cancerous lesions can form up here.
Okay.
Well, if you're going to a traditional doctor, and the tools that they use to remove those lesions are freezing them, cutting them. They're oftentimes, if it's in a sensitive area, they're not going to touch it.
Right.
Because that's not an area where you can perform surgery. You can't cut on the eyelid because there's nothing left. There'd be nothing left to stitch up. So this really gives us the ability to treat lesions that aren't accessible by other means.
Interesting.
Yeah.
Now, are there any possibilities for scarring or anything like
There's
that?
always a possibility for scarring, although over-treating tens of thousands of patients with this, we find that it's minimally scarring and oftentimes no scars whatsoever. Now, we get the best results on the face and the scalp, of course, because that's where there's the most circulation in the skin. And so oftentimes I'll treat patients who remove sometimes very large moles somewhere on the face or other types of lesions. They'll come back for a follow-up in 3 or 4 months, and we can't find where it was. So I'm asking, let's check in and see how it's doing. Well, they're like, I know, I think it was some here on the cheek, and oftentimes, it really is phenomenal sometimes. It's not always that way,
Right,
and
sure.
sometimes it requires multiple treatments, which brings me to one of the other real benefits of this is that we can really see what we're doing. And so after we remove a layer of tissue, we can see what's left. And so there's a tendency, the skin always grows from this basal layer up, and it takes about a month for a cell to complete that whole journey, the basal layer of the epidermis to go all the way up and then slough off. And so if lesions oftentimes will penetrate deeper, and so once we've removed the outer layer, if there's roots, we can see them. Once the scab falls off, we can see if there's anything left, and then we can retreat that.
Wow.
Now, if you're using surgery to remove it, you're just guessing. You know, you're
Right.
just guessing on depth, and that's why you'll often see people who go in, they have a small lesion to go in to have it surgically removed, and then they come out and they have a huge scar because, you know, the doctor's just guessing, and they, if it is cancerous, potentially perhaps they've, you know, they've identified that with biopsy or they can tell through the visual signs, then they want to make sure that they get it all. And so they have one shot at it, and so they're going to really take a lot of tissue. This allows us to be very precise in the application. If we need to treat it again, no problem. It creates minimal inflammation because we're constricting it. And as you know, inflammation is fuel for cancer.
Right.
And you know, and so cutting into a place that's potentially cancerous is like pouring gasoline on a fire. And so you never want to create more inflammation in the treatment of cancer anywhere in the body.
Right.
Try and really
Rein it in. Like
rein it in.
Yeah.
Yeah, so that's the basic of it. The basics of it, you know, in addition to lesions that are potentially cancerous, you know, we treat all types of lesions because the smoother that our skin is, the flatter it is, the healthier that our nervous system is of a whole. And this gets back to the fact that I talked about right at the beginning, that the skin and the nervous system, they come from the same primordial tissue
Right.
when we're in utero, from in the embryologic stage. And so they're intimately connected. And so if we're peppered with skin lesions, even if they're not malignant or cancerous, they're still creating at least some amount of neurologic irritation. And when we start to remove these lesions, we find sometimes very surprisingly how the health can really improve in the patient simply by removing these lesions and restoring the skin to this, you know, to this smooth and, you know, better functioning
Right.
organ.
Absolutely fascinating. It's amazing. The human body is incredible. So, well, it looks like that's about the time. It's a half hour. It goes so fast. It's unbelievable. How can people get in touch with you?
Well, I want to say that I'm psyched that I'm going to start having clinic hours at Siskiyou Vital Medicine. I'll be working there on Thursdays. And so right now it's by appointment only. And so you can contact the office at Siskiyou Vital Medicine. You can get my contact info. We always offer free consultations
Oh,
for
excellent.
the skin. So it's, you know, so if anyone ever has any concern about whether a lesion potentially is dangerous, you know, if it's possible to be removed through this treatment, you're always welcome to come in for a free consultation. I can spend some time with you and let you know. And yeah, I'm really excited to. I've been in Ashland now for almost 6 years in practice. I've been doing the skin lesion removal for 2.5, and I'm really looking forward to, you know, expanding into Medford, working with a great group of people at Siskiyou Vital Medicine.
Right on. And just real quick, you also have your own business, which is Southern Oregon True Health.
That's right, and that's we're here in the Hidden Springs Wellness Facility here in Ashland, which is a beautiful facility. This is where my clinic is located here. I'm one of many practitioners in this wellness center, and yeah, I offer general chiropractic services as well, always with the holistic, holistic bent. And really, starting with the skin lesion, that's a great way to, you know, the skin is such a. This is important. The skin is it's almost like the canary in the coal mine.
Ah, yes.
For what's happening in the internal environment. So if you are having problems in the skin, whether it's acne, whether it's a rash, whether it's lesion formation, that's a clue, and that's a clue that you probably want to investigate because that's a sign that something is off on the inside. 80% of what manifests on the skin is a direct result of what's happening in the internal environment.
I love it.
And so, and so really it's important to really pay attention and then follow up. Removing lesions is great first step, but it's just the first step.
Right.
You know, we need to figure out, why are these lesions forming?
We got to get to the root cause.
We got to get to the root cause. And so I'm really excited to be working with you guys because I feel like as a team, we have just such a great skill set to really investigate and help solve these problems for people to really get.
Excellent.
Yeah.
Excellent. Dr. Freider, thank you so much
thanks,
for
Ron.
the time.
It's
I
been
really
really fun.
appreciate it.
Yeah.
I hope everybody derives some benefit from tonight's show. Sorry that it's not live. We had some technical difficulties. And but next Wednesday, we'll be back up live in-house with Dr. Duncan, Dr. Halsey, and myself. And please bring any pressing health questions that you have to us then. And for now, thank you so much. and I hope you enjoy the rest of your week.
Yeah, thanks for taking the time. Be well.